Hello, everyone, and thanks for joining us tonight or today, wherever you are in the world. And it's going to be a very interesting conversation about prototyping, 3D printing, and of course, intelligent displays around transforming critical care for patients. My name is Ali Khan. I'm part of 4D Systems, and I'll be your host for the next 30 minutes. I would like to get started by acknowledging the traditional owners of the country and I'm here in Australia, and their ongoing connection to land, sea, and communities that we are so privileged to work from. I'm zooming to you today from the Kulin Nation, the lands of the Wurundjeri people, and extend that same respect to the traditional owners of the various lands that you are on today. Now, before I get underway and introduce you to the man that you've come to hear from, a couple of notes on housekeeping. So you can type your questions in the Q&A box, and we'll get to them at the end of this discussion. Drop them in any time, and if you have any questions that we might not get to within this session, we will always follow up, and you can submit them to us at any time via email as well. So let me kick off. You can see him on screen. Let me officially introduce you to Leonardo Bilalis, a healthcare 3D application consultant at the Design to Manufacturing Corporation and PhD candidate at the University of Piraeus. Leonardo, welcome.
Thank you. Thank you for having me.
So, can you tell us about this mask? And I'm going to bring up a slide share to show you. But what I want to ask you is, can you tell us about this mask and why it is such an important step forward for critical patient care today? So let me show everyone on the call what we are talking about.
Yep. We've started in the beginning of COVID with an idea to improve, let's say, and help the patient, the hospital staff, nurses, and doctors to, let's say, have a device very fast and in these very difficult COVID days. So we've designed, let's say, in the beginning, a very basic medical mask. And nowadays we have improved this CAD model, and we have embedded an LCD display and sensors that will provide the critical and vital stuff from the patient.
Okay, let me stop sharing.
Yeah. Yep, let me show it to you. This is actually a final model. Also, we have 3D print a face in order to do some fitting testings. And you can see here the LCD that will provide to the nurses and doctors some information from the sensors.
Fantastic. So let me get some more images up that we can talk to, because the next question I really am interested in is, what has that prototyping journey been like so far? And I guess, have there been any surprising challenges that you've come across that you've had to, I guess, work through? I'm sure there's plenty. Let me bring up some examples for everyone.
Good. As you can see, we've 3D printed a model. It's a real 3D printer. And at the beginning, we have experience with normal 3D printers, a problem that the materials are not biocompatible. They do not have a certification for biocompatibility. So we decided to 3D print the model. And if you want me to share one final model, that's a model we finally 3D printed with biocompatible materials. And as you can see, it's a transparent, there are no colors. because in medicine we need to focus on the biocompatibility. So this model and materials that is being used here are fully certified and with biocompatibility. And they are certified with a permanent touch skin, contact actually skin.
Amazing. Just to ensure that there's no seal.
Alexandra, let me also try to share, if I can. This is the screen. I don't know if it's clear now.
Yes, it is clear.
And right now, you can see some sensor information like humidity, temperature of the environment, and temperature of the inside of the mask, the patient. But now, okay, it's like a demo right now.
There's no humidity in there.
Yep. Sure.
Fantastic. No, it sounds like a very, very exciting, well, and I guess extensive prototyping journey that is going to be continuing as well. So, following on, I guess that display that you just had up on screen, let me get a visual of that for everyone. Now, can everyone see this?
Yep.
So this is obviously the display that you just had on the mask, and it's the 4D Systems Pixie LCD 13P2. I guess in choosing this particular display, what were the critical requirements for you?
Oh, that was a good challenge for us from the very beginning, because we wanted to have a very tiny LCD which offers a great flexibility for the designer, because 4D system has already gave to us the step file. The designers understand how important is to have a ready step file, actually a drawing, a 3D CAD model to embed it or our design. So that saved us a lot of time. Also, as you could see before, it offers a wide viewing angle. It's a very bright LCD, very sharp. We can use a lot of information on a very, very tiny small LCD, and it's clear to see it. Also, it has an embedded display driver, so it saves us also a lot of time on background programming. And it provides also the programmer with two different operating platforms. One is from 4D system, and one is open to everyone to use its own programming language. And that's very, very important also for everyone. For me, it has an extended, let's say, Bluetooth interface, which is very important for us, because later I'll show you that we have to transfer the information from inside the ICU to outside of the room. And yeah, that was a very good choice for us.
Fantastic. And it makes it very clear. The different colors make it very clear what you're looking for, and I can imagine for doctors and nurses who are relying on this to give them a very quick understanding of the patient's health.
Yeah,
They can start to
and
know, okay, that's humidity's yellow, and
yeah.
very quickly pick it up.
Yeah, we have chosen actually colors that match to what they have to, you know, to see first. I mean, the most critical ones are the pulse of the heart, and then it's coming for us the temperature of the inside of the mask and the humidity at the same time.
Fantastic. Fantastic. And so, can you tell us, or I've jumped a slide, but just can you talk a little bit more around the sensors and how you are, because often pulse sensors are not taken from the face. They're often taken from, the wrist. How are
Yep,
you
yep.
able to simplify the data gathering within the mask and then relay that to the device?
At the moment, we have internal inside of the mask, as I said, a humidity sensor and temperature sensor. Together, we have imported pulse sensor for the heart that we gather the information very close under the eye here or on top of the lips. There are some um, uh, let's say, uh, guides from the heart that we can gather information from there safely. And it takes a lot of effort from the programming side to get the correct information from there.
Fantastic. Fantastic. So let me continue. So here,
Mhm.
um, so tell me then around how you actually then transport this information from the mask to the display.
Yeah. Um, we can, as I said before, we use the Bluetooth technology to transfer the information from the mask that let me if I can show to the screen
Yep,
again.
I'll turn this off.
Yeah, we transfer the information via Bluetooth from the mask here outside to the big screen. It's also from 40 systems. It's very big screen, also touch screen. We can change information from here, and the communication between them is Bluetooth. That is very, very important also for the doctor and nurse. In case of a very critical, let's say, infection, they don't have to go inside to check the medical mask and the information that we have here, but we have imported to our project a bigger screen that will be outside from the room. The same informations are displayed, and it's another step that increasing protection for the patient. And we gather information and we share it outside of the room, and that's very, very important for everyone, for safety reasons, actually.
To reduce that, if you're not required to go in as a doctor or nurse, you can mitigate, any additional infection being transferred into that room for the ICU patient.
Sure, it's both way, yeah, for
Fantastic.
both, let's say, safety reasons.
Yes, absolutely. So then I guess where are you then at um, in your journey? Because naturally transformation projects like this take a lot of time to carefully prototype and test. Um, where are you at in the journey, and then where what is still to come?
Hmm. Right now, we have a final CAD model. We have the final 3D printed model. In terms of programming and all the sensors are working. So we hope that till the end of 2023, we can do some testing in 2 hospitals in Greece.
Hmm.
Then the next year on 2024, the whole year we're gonna work with 2 hospitals in Europe. One will be in Germany and one will be in UK. And at the end of 2025, we're gonna gather all this information. We're gonna have the feedbacks from doctors and patients from ICUs, and we're gonna continue customizing some final programming or designing issues that we are going to face, because for sure going to experience some issues during this journey, and we're going to improve the model.
Fantastic. So, I guess, and part of that is that feedback from doctors and patients is those clinical trials will naturally, take place over those hospitals, within those hospitals, in two different countries, and from that, then the then the next phase is really to, I guess, close out the mask, um, and then I guess there's a phase, a bigger phase beyond that, because even after those 3 years, your vision for transforming critical patient care is, beyond that as well. Because I know I've got some slides up on the screen now that ultimately you want your mask to be used outside of hospitals. Can you tell
Yeah.
us a little bit more around how you envisage that?
Yeah. For let's say an everyday case that nobody would like to have, it's like an accident outside, and an ambulance is arriving on spot. We have to get very fast all the information, the vital information from the patient. So we're gonna use the mask on him if it's possible, and we're gonna transfer via um, uh, a network uh, uh, from the area that the accident is to back to the hospital. So the doctors will have the information from the patient in real time during his, let's say, his way from the accident to the hospital. So every moment we have on the screen, like on this screen, the information real time from the patient. So that's a next level that I think nobody have done at the moment. So imagine we have real time information, and the doctors are ready for what are they going to face before, they're that would be very good to have. I mean, for me, because I have worked in a hospital for 5 years, I would like to know this kind of information before the patient arrives in our hands.
Understand. It's very exciting, and I just think um, it is, as you say, it's nothing. It is completely transformative. Some projects like to be called transformative, but in this case, it would completely transform critical patient care because we know how important those first moments are. So then, I obviously this is phase two.
Yep.
But I know a lot of people on the call are interested in the layers of, I guess, the data transfer and how you communicate that data. And so I thought maybe as we look to, um, you know, we could build out how this would actually come together. Can you talk us through a little bit of that architecture for the future?
Yep. Let's say we're gonna have first of all a global system communication. We're gonna know where exactly the patient, the ambulance is, how long the ambulance it requires to arrive in the hospital. We're gonna have a hospital system alert. We're gonna have a provider that will give us the access, the secure access to transfer this data. Uh, we're gonna have a big system that will gather all this information and will share this information also to other hospitals if required. For example, if the hospital is full, we cannot accept any other patients. We're gonna send directly to the nearest hospital, and that help us to gather and give all this, to share this information, because all of the sensors that will be imported on the medical mask. So the sensors will be on the medical mask, and through there we're gonna decide where the patient is gonna go, in which hospital.
And that GPS system, again, we've all got a GPS system on us with our phones and tracking devices, but the idea of having it connected to the patient's vital data,
Yep.
and doing that where it's interconnected with the healthcare system is a huge leap forward. Do we?
Yep, it is.
So I've got a lot. I've got a lot of questions, but I know there's probably a lot of questions on the slide. So I'm going to actually move us into Q&A, so that we can use these last 8 minutes of your time to pick your brain. So let me stop sharing, and I will have a look at some of these questions. But I guess one question. So let's start with the questions. What is the power supply of the mask?
Yeah, that's good questions, and yeah, that's a challenge we have from the beginning up to now. We're going when the medical mask is inside the intensive care unit, we're gonna power it up through an external power, like let's say power bank. That's very simple. We can do. The same we're gonna do when is on road on an ambulance. We will try to have a design on the next step that we're gonna have a very, very small battery on the let's say CAD on the medical mask, but that haven't been delivered yet to our design. I mean, we haven't embedded a battery at the moment for many reasons. So at the moment, we're gonna have an external wire that is going to connect it to a power bank or to an external, let's say, power inside the intensive care unit. That's very easy. That's a normal thing that we all do.
Fantastic. Hope that answers your question. So another question we've got, are there any measures to prevent the risk of destruction of the display and the ingress of particles into the patient's respiratory tract?
If I understood well, it's related to infection, or
So are there any measures to prevent the risk of destruction of the display? So if the display was to, I guess, if anything was to come off the display, is there any risk of the particles being ingested
no,
or into
no,
the patient's respiratory
no,
tract?
no, it's not. We have covered on inside from the mask. There's a layer that we protect actually the patient from any external particles coming in. And
Fantastic.
also the medical mask and all the electronics before we apply to any patient, they are sterilized in many ways.
That's what I was going to ask you actually, is that, with this mask being so important for minimizing infectious, I guess protecting patient health and infectious diseases, how do you go about sterilizing it?
Yeah, there is one way we do it up to now with steam. That's the only way we can do it because of the materials we are using. This is a resin material. It cannot go through the normal sterilization methods we have up to now for, let's say, metal parts that they are using in a surgical environment. Uh, but we have another way to do it to sterilize the material, and it's with steam method. Actually, we do not use a heat process like more than 50 degrees. And we have gathered information from biomedical engineers that the sterilization is 100% secure on this model.
Fantastic. I can imagine that's a very critical part of your testing and your prototyping as well. And one thing in terms of the mask, my experience with masks has been largely the disposable ones that we've all had to wear over the last couple of years. And I know sustainability and waste has been a big part of the discussion. Is there anything that this mask does from a sustainability perspective, or reducing the environmental impact of masks?
This is the first thing that we've thought from the very beginning. That's why we use biocompatible materials. The materials are not only biocompatible, but they are biodisposable also. So we are very, let's say, happy that we are using materials that not only are biocompatible, but we can, let's say, throw this to the environment, and they can dissolve by itself in the nature. That's why we use this company. We've used this kind of materials, and they are also certified for both and biocompatibility and for safe to dissolve it in the nature.
Fantastic. Well, that's excellent to hear. We have another question from Roberto, and he says, I noticed wires coming out of the back of the mask. Are the wires inside the mask material, or do they make contact with the patient?
No, they are not having a contact with the patient. We have, as I said before, a layer in between the electronics and the internal face of the patient that protects actually everything in the patient and the electronics. But I would like to mention here, from the time that we sterilize everything, it doesn't matter if also we haven't, have this protection layer. I mean, it's the same thing. Also, electronics can be sterilized together with the mask. Electronics doesn't get any effect from the sterilization method.
Fantastic. That is it for our questions today. So
Nice.
At 6:29, I think that feels like a pretty great place to end the webinar. As I said, if there's any further questions that you have, please feel free to email them through to us, and we can get them to Leonardo and get a response to you. But there is obviously so much more of this project that I look forward to staying across, and particularly the next testing phases. So Leonardo, thank you so much for being so open and sharing your expertise and this project with us all today. And thank you everyone for attending the session. I hope you walked away with a lot of great learnings and some insight in what you can do in the medical industry with intelligent displays. So thanks again, Leonardo, and I hope everyone on the call has a wonderful day.